Hello everyone. Today we'd like to talk something about pulmonary thromboembolism. First, let's take a look at several definitions: PTE, DVT, VTE, and PE. So what is PTE? PTE is pulmonary thromboembolism, which occurs when there is a disruption of the flow of blood in the pulmonary artery or its branches by thrombus that originated somewhere else. What is DVT? In deep vein thrombosis, a thrombus can develop within the deep veins and most commonly in the lower extremities. If part of this thrombus breaks off and enters the pulmonary circulation, it can cause pulmonary thromboembolism. This picture shows how DVT can cause pulmonary thromboembolism. Part of the thrombus breaks off, goes into circulation, then into pulmonary circulation, block the pulmonary artery or its branches, cause pulmonary thromboembolism. And what is VTE? Actually, PTE and DVT together are called VTE, which is venous thromboembolism. And we have a special type of PTE, that is paradoxical PTE. Well, the thrombus formed in actually left atrium, and if part of the thrombus breaks off, it can go through a patent foramen ovale or atrial septal defect into right atrium, then into pulmonary circulation and block pulmonary artery or its branches and cause pulmonary thromboembolism. Another special type of pulmonary thromboembolism is pulmonary infection. It is actually a very small pulmonary thromboembolism. Usually it's very painful. Thrombus lodges peripherally near the innervation pleural nerves. In pulmonary infection, we can see cushion-like or hemispherical consolidation with the base lying along the surface of the visceral pleura. You can see on this CT scan the cushion-like consolidation and also the hemispherical consolidation. And please note the focal hyperlucency in the center of the consolidation, which may suggest necrosis in the center. Here is a study. It tells us the symptoms of pulmonary infection. This study compares those with pulmonary infection and those with pulmonary thromboembolism and without pulmonary infection. You can see here all these patients, all these two groups of patients, they all have sudden onset dyspnea. But those with pulmonary infection, they have more chest pain and have more hemoptysis, that is blood coughing. And for those with pulmonary thromboembolism but without pulmonary infection, they have more fainting and syncope. Most patients with pulmonary infection, they are at around the age of 40. And what's interesting is that the higher is the patient with pulmonary thromboembolism, the more possible they may have pulmonary infection. We have a lot of types of thrombus materials that may cause pulmonary embolism, not just thrombus. Here you can see we have amniotic fluid embolism, we have air embolism, we have tumor embolism, we have fat embolism, bone marrow embolism, we have even cement or bony fragment embolism. And we also can have hair, talc, or even cotton that goes into circulation and block pulmonary arterial branches and cause pulmonary embolism. But of course, thrombus is the most common material that causes pulmonary thromboembolism. So pulmonary thromboembolism is the most common type of pulmonary embolism. Okay, that's all for our definitions.